Okay, so it looks like everyone is in now from the waiting room, so we're going to get started. Welcome, everyone. I don't know how many of you have attended exchange workshops before, but this is a program of research dissemination and knowledge exchange that we run from the Cascade Research Centre at Cardiff University. It's called Exchange because it's all about an exchange of knowledge and expertise, but not only from researchers to practitioners, but from practitioners to each other and to researchers, so that we can all try to build better social care in Wales. So this is one of a series of workshops that we've been running during lockdown, and we've got plenty more coming up. So if this is your first time at Exchange, do go onto our website at Exchange Wales and have a look at the ones we've got coming up, because there's loads of exciting things happening despite our social distancing restrictions. Just a couple of notes on how this session will actually run. You've all got the message about having your videos off. If you haven't got your video off, please do put it off now. It is being recorded for our Exchange YouTube channel. If your video is off, obviously, even if you speak, your video will not be on the video itself. However, your audio will be audible if you do speak and ask a question or any comments. On asking questions and comments, we do ask that you put all questions and comments in the chat box, and we will do our best to answer them in the chat box as we go along. If any we don't get round to, then we will respond to you all after the session has finished. But do feel free to use the chat box as a tool for your own discussion and feedback as we go. It's always nice to see a really vibrant ongoing chat going on in the chat box. So let's get started. So our workshop is called From Identification to Support, Assessing and Improving Services for Young Carers. We're covering a range of subjects in this workshop, and it's a really appropriate day to run it because it's actually Carers' Rights Day, a day to raise awareness about the support needs and a role of carers of all ages in our society. So we have some fantastic speakers today, and I'd just like to start with introducing my colleagues here, and we'll start with Faiza Bashir from Carers Trust. Faiza, if you'd like to introduce yourself, please.
Hi everyone, my name's Faiza. I'm the Policy Research and Engagement Manager at Carers Trust Wales, which is a national organisation that works with and for carers. And I will hand you over to Kat, who works for one of our network partners.
So I'm Kat. I work with young carers in Carmarthenshire in a project called the Key Project, and we work with under 18s. And I'll hand over to Ed.
Hi, I'm Ed James. I'm a PhD student in Cardiff University studying young carers and mental health, and I'm involved in Cascade and also in Decipher, which is the public health team. And back to Jen.
So hi everyone. So yeah, my name's Jen and I'm a researcher at Cascade, working primarily with care experienced children and young people, and also for the purposes of this workshop with young carers. So thank you everyone for introducing yourselves. Just to give you a brief overview of the workshop structure, we start off with a general introduction to young carers and their role in case anyone's sort of new to this subject, and a brief discussion led by Faiza and Kat on the impact of caring on children and young people. They also address the specific implications of the pandemic and how this has affected young carers during the past, what is it now, 9 months? And then we move quickly over to Ed, who's going to give us a brief rundown of previous research on young carers. I'll give you a clue about how that's going to go. There isn't a huge amount, hence the research that we've done here. But what is there is some really lovely qualitative and quantitative research, which is really interesting. I'm then going to speak briefly about a project I did a few years ago now called Young Carers Speak Out, which was run directly with young carers themselves and involved a survey and some creative workshops, which were really fun to do with 50 children and young people. Faiza and Kat will talk about the importance and role of proper assessment for young carers to identify their care and support needs. And then Ed will be talking us through his fascinating PhD research, Caring Lives, where he discusses different intervention strategies and how they work in practice and what kind of benefits they can offer. And we'll then be having a brief breakout activity. This will be quite brief. It's going to be between 10 and 15 minutes, depending on what time we actually get there. So if you do have comments to make for the breakouts, please do consider how you can make them quite succinct and concise so that we can get through as many people as possible. And you'll be broken into 3 groups for that activity. And then we'll briefly come back for a summary of the workshops, of the breakouts, sorry, and Faiza will talk about the future implications of the research that we've talked about today. So to kick us off, I'm just going to hand over to Faiza to talk about who are young carers.
Hi everyone. So I'm sure lots of you are familiar with this, but it's always worth reminding ourselves, particularly because the word caring is often used interchangeably with paid carers who work in care homes or domiciliary carers. But a young carer is someone who helps to look after someone in their family or a friend or a neighbor who's ill through disability, through due to a mental health condition, or perhaps because of addiction issues with drugs or alcohol. In terms of the age, it's not necessarily always as straightforward as someone under 18. There can be quite different definitions used in different contexts, and I don't know if maybe perhaps Ed will come across that when he's talking about about the literature review. But young carers can be any age, particularly, and they can be any age, even as young as 4 or 5 when they start caring. And I think sometimes it's quite difficult to know how young carers can be, because young people are so used to doing the caring that they don't realize that they're carers. So we'll have carers who kind of identify as carers when they're 18, and then they'll say, oh yeah, but I've been actually doing that since I was 8 years old or whatever. The other thing to note is that carers aren't always looking after their parents. It can be a grandparent and it can be a sibling, and often they're not necessarily sometimes they can be the primary carer, the key person who's the only person in the household who's looking after someone, but often they might be a secondary carer, or because their parent is looking after another sibling who's unwell, they end up being kind of playing the parental role. So that still counts as caring, if they're looking after another sibling who's unwell because their parents are looking after a sibling who has an illness or disability, like I mentioned. And I just wanted to bring in Kat to ask whether she's got any kind of examples to kind of bring that to life. And I suppose the last thing to mention is that it's the caring that someone does isn't always a physically looking after someone by giving them medication or helping them move around. They can provide really important and essential emotional support for that person. So yeah, Kat, if you've got a couple of examples, that would be great. I'll put myself on mute.
So I know Faiza's already mentioned about the age thing. I think a lot of people are quite shocked to find out that we work with 5-year-olds. I've got quite a few 5-year-olds at the moment who are in quite substantial caring roles. And when people talk about young carers, they presume that they must be older to have that responsibility, but actually children just get on with it, and whatever their family needs is what they do. Quite often the younger children, it's more an emotional impact, things that they witness, but also they are doing practical stuff as well. Something else that a lot of people don't always realize is some children are in caring roles for more than one person. So our record at the moment is an 11-year-old boy who's in a caring role for 4 people, which is his mum, dad, gran and brother, who all live in the same house. So he is the only person in the house who is fully able to do everything, and he's 11, so it's a huge responsibility. People don't always realize that medical conditions and situations that you might not think would need a carer actually do. So I've got one family whose mum has an allergy, which might seem very boring and not very in need of care, but her allergy is that when she moves, her whole body comes out in hives. So when she takes the kids on the school run, she has to recover for 2 hours with medication to be able to even walk. So you can imagine what weekends and evenings are like with 4 children. So her oldest son has to become the parent while she's having to rest. And the other thing that a lot of people don't realise is young carers can be disabled themselves. And a lot of people say, well, if they're disabled, then they can't be a carer because they need care, but they can be both. So I've got a young person with cerebral palsy, I've got several with epilepsy, lots with autism who are also caring for someone else. So it's never straightforward. There's always lots of complicated variations of what a young carer's life might look like.
Thank you, Kat. So I will move over to the next slide if I'm able to, which is about the impact of caring. I'm going to just explain a few of the outcomes that I'm aware of, but while I'm talking, it would be really helpful for everyone in the room to talk about your own experiences of young people that you might work with, and kind of your understanding of the impact on young people, particularly what you think is the most significant or kind of the lesser known impacts. So obviously in terms of caring, that it's a huge part of someone's, a young person's identity, and there can be a lot of negative and positive impacts on people. In terms of, I suppose one of the key areas that matters to, that is a big part of a young person's life is education. And we know from a lot of research that young people end up missing school, missing days of school. So punctuality is lower. They might be arriving late. They might be missing school due to hospital appointments. And that not only affects their education in the short term and their learning and their attainment, that can have negative consequences for their life chances. But as well as the educational impact, sorry, there's a postman at the door looking at me, so it's hard to concentrate. As well as the impact on education due to missing school, obviously that has implications on their social life. School isn't just about being able to learn, it's about being able to go out with your friends, do your hobbies, and young carers can really miss out on that. And the other aspect to mention is that there was a really large piece of research done with Dr. Phelan Lewis from Sussex University that spanned a number of different European countries, and the impact on the physical and mental health of the 15 to 17-year-olds they discussed was significant. So 30% of young people reported that they had mental health issues of themselves due to caring, and 30% reported that they had physical issues of their own due to caring, and 60% reported that they had mental health issues. And obviously the reasons for that are myriad, and I'm going to let Jen and Ed explore those a bit later, but I wanted to bring Kat back in so that she could kind of bring to life some of those statistics that I've shared.
Yeah, so I've got a few quotes from some of the young people and their families. So one of the things we find, particularly with the younger children who are in a caring role, is they often feel overlooked, and that all the health professionals and teachers and doctors that talk to the family talk about they're cared for, and they're just the extra body that's also in the room. And one mum said that because of this young carer's sister, who's they're cared for, because of her condition, everyone in their village and their town knows her. And when they see them, they'll go up to her and ask how she is and talk to her. And no one's ever stopped to ask the brother's name or ask how he is. He's just this extra kid that follows round, when actually he's a person in his own right. And there is that sense that the siblings of disabled children particularly are just overlooked and forgotten about, which has a massive impact on their sense of well-being. But also we find that young carers have this idea that their own lives and their own well-being is something to be sacrificed for the person they cared for. So I was talking with two of my 16-year-old girls, and one of them said, I've just accepted that I'm not going to go to uni. I would love to go to uni, but I'm just going to have to get a job because this is my life now. I have to keep him alive. And she's just accepted that her lot in life is to keep someone else going, which is a wonderfully selfless thing, but also she shouldn't have to choose between her own future and that of someone she loves. Both should be an option. And as Faiza said, mental health is a huge issue. We've had several young carers, not just this year with everything going on, but in the past, whose mental health has got so bad that they've actually become someone who needs intensive caring themselves. We're frequently dealing with self-harm, suicide attempts, very difficult times for young carers as they're carrying so much weight on such young shoulders.
Okay, so I'm going to move to the next slide. I don't know if I've got the ability to move to the next slide, Jen.
No, Faiza, I'm doing it for
Can
you, but for some reason it's not sort of doing it straight away. There we go.
Yeah, if we skip this slide, Jen, and then go to the next one.
No props.
So I just wanted to kind of set the scene for the Welsh policy landscape for carers. The most significant piece of legislation that's relevant is the Social Services and Wellbeing Act, which came into force in 2014, but April 2016 is when it was rolled out. In terms of what the Social Services and Wellbeing Act does, which we'll talk about a little bit later in the assessments area, is that it makes sure that the needs and the well-being of carers is on an equal footing as those of the people being cared for, and local authorities must, if there's a need, we talked about some of the impacts already, if there is a need for young people's well-being to be improved, and the local authority can see that, they must offer a carer's needs assessment to that young person. In terms of the kind of oversight of carers' rights, it comes under the portfolio of the Deputy Minister Julie Morgan, and alongside that we've got the Ministerial Advisory Group, and that group advise the minister about the needs of carers, and it's a broad collection of organisations and individuals, which is really good because there's then a holistic understanding of the needs of carers, and they look at the needs of carers according to Wales's 3 national priorities for carers. So the first one of these is around identification and recognition, and I almost said simply identification and recognition, but as many of us, as we all know, it's extremely difficult for people to identify self-identify as carers because they're not used to the terminology. They might not know where to get support. They've never been asked. There might be cultural language barriers, all sorts of reasons. So the first one of those priorities for Wales is identification and recognition. The second one is, wait, I need to look at my list because that postman's distracted me. Sorry, I'll go into the third one because I can't remember the second one. The third one is about making sure that, that people have a life alongside caring. So it's important that carers are able to get a break to do what matters to them. They're not just a carer; they're a citizen with their own aspirations. So it's really important that they're able to get a break from caring, whether that be through attending young carers groups or making sure that there's enough kind of professional support in there for the person that they care for. The third one is around being able to access information and assistance and support. At the moment, there is a national, there's a development of a new strategy which is out for consultation at the moment, and that is open until I think it's the 20th of January. And that in that one of the key proposals is that, which is a really welcome proposal from my point of view and my organisation's point of view, is that the fourth additional priority is that carers, education and employment is addressed as one of the key priorities separately. And I think that will really be helpful in providing the framework for schools, universities and employers to be able to advocate for carers. Because of the timing, I'm gonna skip talking about education and organizations for now, and I'll come back to it if there's time later. But I'm just gonna show you a little video about a new initiative, which is the Young Carers ID card, which is something that lots of people have been working for many years. So I'll let the video explain itself.
Them properly. It's so much less stressful for me now.
I'm a young carer, and I'm not alone. Right now, thousands of young people are looking after a member of their family who is ill, frail, disabled, or has a mental health condition or addiction. Many don't realise that what we do every day makes us young carers. Every family is different, but we do the things that adults tend to do in other families. It could be anything like helping the person we care for get ready for the day, cooking meals, giving medication, speaking to people like doctors and social workers, paying bills, being the strong one when someone's feeling low, taking younger siblings to school, and my favourite, taking my little sister to football. Some people look at us like we're superheroes and give us loads of sympathy.
Oh, love you. It'll get better soon.
But we're not superheroes. We're just doing the best we can, and sometimes that can be really hard. What we need is for everyone working in schools, pharmacies, hospitals and GP surgeries to work with us to find ways to make our lives a bit easier.
Young carers have told us they want an ID card to help make sure they can get the support they need and the recognition they deserve. By having an ID card, they feel that they will have more confidence to talk about their caring role to health, social care and education professionals, and to ask for help when they need it. Welsh Government, Carers Trust Wales and local authorities across Wales have worked together so that all carers aged 18 and under will be able to get an ID card by 2022. Some councils will make them available even sooner. The ID card helps schools to support young carers to remain motivated and enthusiastic learners.
It makes it easier to speak up when I'm late because taking my sister to school means I miss my school bus, or when I'm struggling to get homework done because my mum's been admitted to hospital.
It can also empower young carers to ask for help when they need to.
Now I know that teachers will take the time to understand the pressures I'm facing. I'm not afraid to ask for the help that I need to keep up with schoolwork and have time for my friends.
Pharmacists will know that a young person plays an important role in caring for someone if they're carrying a young carer's ID card.
Sorry, everyone.
Them properly. It's so much less stressful.
Sorry, I don't know why it's stopping.
That's okay, Jen. I think I'll move on now because of timing. And what I'll do is I'll send the link round so that people can watch it. But I guess the thing to note is that it's a really, really, really exciting step forward that will have real transformational change for young carers. It's basically a way for young carers to be identified and recognized, and then the next step is for professionals to be able to offer them the support that they're entitled to. the only thing I'm going to say about the impact of COVID right now is that we did a survey speaking to about 300 young carers up to the age of 25, and it makes really stark reading. Again, I'll put the link on the chat in the website, but I'd encourage you to read it, because the quotes in there are you know, not, they're quite difficult to read. There's a lot of talk about feeling trapped, about self-harm, about not having a break, not being able to cope. There's a lot of you know, people feeling very isolated out there and not being able to keep up with schoolwork, etc. The one positive piece of news is that Carers Trust Wales are distributing over the next 5 months £1 million of a carers support fund, which is being released by Welsh Government. So over the next 5 months, through every carer will be entitled to access grants of up to £300 for what they need, whether it's a laptop to keep in touch with someone, whether it's to replace a washing machine that's broken. So I'm going to leave it there so I can hand over to I think it's Ed next, isn't it? So sorry, it's been a whistle-stop tour.
Okay, thanks, Faiza. So just to say thank you to everyone that has put impacts in the chat. So we've had things like education, impact on education, mental health, anxiety, lack of personal time. These are the kind of issues that me and Jen are going to pick up quite a lot in terms of our findings. But there are, you know, there's a range of negatives and positives, also things like independence and confidence and that kind of thing. So I'm going to breeze through some examples of past research and also past issues that we're seeing in research that's been done to date. The first one of these is around the varying estimates of prevalence. So we've put a chart up here that, so this lists about 7 studies going back about 30 years, and you can see the varying prevalence. Just to explain that the studies marked in blue are large-scale quant studies, so that's where young carer questions were one part of a much larger survey, and then studies marked in green were focused on young carers alone. So there's a number of reasons why there's been variations in estimates that have been quite so big. If you look at the earlier studies, so for example, White and Walker, you had something called upscaling, which is where research is done with relatively small groups, and then the percentage from that gets applied to the whole population. It can be a problem because when your percentage is so small and when your sample is also quite small, you get these really large ranges. So Walker's one of the most well-known estimates, 19,000 to 51,000 young carers across the UK. What that means is, it is just as likely to be 19,000 as it is to be 51,000 or any number in between. So you can see you start to lose the meaning. You start to lose the meaning in terms of like what it's saying. You also have complexity of the term. So Pfizer gave a really good definition at the start. You can see it's got lots of moving parts, and it needs to have lots of moving parts because it's complex. But this resulted in big variations in terms of what questions were being asked and how young carers were being defined in early research. So you had inclusion of 18 to 25-year-olds. You had some studies including young people that looked after people with mental health or substance misuse issues. You also had this idea of substantial care. So some studies were saying a young person's only a young carer if they care for more than 10 hours. So anyone under that barrier was basically being included as a non-young carer in studies. You've got the census from 2011, so it's marked here as ONS. That question was asked to parents when we know that parents are often reluctant to come forward. There's also examples of teachers being asked, and if you ask teachers to identify young carers, you have a study of their awareness of young carers rather than a study of prevalence. So moving on to some of these more recent ones, we've got LSIPE, which is the longitudinal study of young people in England, and we've got SHERN, which is the School Health Research Network that is based in Cardiff University. So these are large-scale quant studies, as I mentioned previously, and they're seen as better practice partly because young people will ask these questions themselves, and partly because there's confidentiality processes. So it means that someone can feel that they can answer without their school or their parents or social services or other groups being told. But as you can see, the figures are still really variable. So LSIPE saying between 5 and 6%, SHERN saying 17%. And it leads to quite a big challenge because if prevalence studies are being used to inform funding for services and there's a lot of uncertainty, it starts to undermine the funding in this process. So I'm going to move on to a couple which are briefer. So if we move, yeah, thank you. So this one is considering quality of support. So in 2017, Lew and Becker basically took all countries that had produced young carers research and classified them in terms of whether governments recognised young carers as needing extra support, in terms of young carers being considered in legislation and policy, and then in terms of provision of services. So there were 7 categories, from incorporated, which is highest, to no apparent response, which is lowest. No country was placed in the top level. The UK was placed in the second on their own. The reason for that is it was felt that we benefit from a large amount of research that impacted on policy and legislation over time. The reason we want higher is because it was felt there's a lack of resources to match the ambition that we see, and that causes the ambition that we see in legislation, which causes people to fall through the gaps. And that kind of goes back to the previous slide on prevalence and the need to know numbers to provide the right services. And then in terms of the third one, so this last one is on, it's more on what don't we know about young carers rather than what we know from past research. So if there are challenges in identifying because young carers and their parents don't tell schools, don't tell social services, don't tell health, that hampers the research that can go on in mainstream services. But how do we know that the lives and experiences of those that are accessing services and being supported are the same as those who are not? Do they spend the same amount of time caring? Do they have the same role? Are the impacts the same? You also have this kind of challenge that the ones that are accessing services are being involved in research are hopefully receiving benefits, whereas the ones that aren't being involved in research aren't. So it leads to this question, if we don't know that they are representative, how do we reach the wider group so that we know that research that's going on is the research of the lives of all young carers? So I'm going to pass back to Jen, I think.
We're just going to introduce the original research that Ed and I have done on young carers, and I'll just discuss my project first. So I ran the Young Carers Speak Out research in 2016-2017 on behalf of Cardiff and Vale councils and in partnership with the YMCA Young Carers Project. So this research was really focused on children's voices and experiences themselves. And the data we collected through an online survey of local young carers in the Cardiff and Vale Glamorgan area. And we got 101 survey responses, which is pretty good for such a localized area. And the thing that really struck me about the survey was the range of ages that we had. So we had respondents from 7 to 19. The younger respondents tended to have support in completing their surveys, whilst the older ones did it themselves. But what we found is that they were extremely eager to share their experiences in detail. They clearly had a lot of very passionate views and some very vivid experiences, which they shared with us. So that was some fantastic data that we got. And then we ran a workshop in collaboration with the YMCA Young Carers Project, where we had 50 participants. And again, this was a really wide age range. So we had to come up with lots and lots of different activities to allow them to creatively express their views and experiences. And I'll tell you about a few of them as I talk through my data, but it meant we could look at the various issues and challenges that they face from lots of different angles, and it produced some really lovely data, which I'm really excited to share with you. And I'll just let Ed introduce his study now. Ed?
Yes, I'll give a very, very brief outline because we're going to come back to mine in a minute. So Caring Lives is my PhD study on young carers and mental health. It is a realist approach, which basically means that I'm not only interested in the impacts of being a young carer, but I'm interested in how the impacts vary between different young carers and how support will make a difference to their lives.
Okay, so I'm just going to start sharing some details about my project. And the slide decides to change. There we are. So you can actually read the reports from this project. It's available online. I should have put a link in here really, but I can send a link out afterwards when we send you the links to the video and things. So the report was written in 2016, and it's gone on to impact the way that Cardiff and Vale support and guide practitioners on supporting young carers. So that's been a really lovely impact from the project. You can see from the pictures here just a little bit of the kind of creative methods that we use to elicit their views and experiences. The one on the top left of the pictures, rather than the report itself, is an example of an activity we did where we drew these flowers for young carers to put their post-it notes on to talk about the different things in their lives which help them to grow and develop as people outside and inside of their caring roles. So that sometimes this was the names of people, sometimes this was support services, and sometimes it was simply things like friends or watching TV and video games, things that gave them a chance to relax and have some time out. The next picture you can see to its right is another activity we did called Letters to the First Minister, where we provided letter templates with different prompts for them to say how they would like to have an impact on the way that support services are provided for them. And again, this was a chance for them to really express their opinions about what they needed more of and what they were lacking in terms of their support, and also to say about the things that were actually working really well for them. And we had this cool little post box where they all got to post their letters and the messages got sent on to Welsh Government. So that was very exciting. The one at the bottom is what we call an eco map. So if you're not familiar with this, it's a way of mapping different relationships. It's mostly used around people, but it can also be in relation to institutions. The eco maps that we did referred specifically to their support networks. The inner ring is who is really close to them and supports them most in their everyday lives. Then you have the middle ring, and that's people who give them a moderate amount of support but can't be there all the time. And then you have the outer ring, which is people who don't really support them very much, but perhaps could. And if you can see on this eco map that we've shared here, you can see the young person has drawn arrows, and it's indicating with those arrows where the young person would like better support from these people. So if you can see that they've actually put teachers on the outer ring, but they've put an arrow to the middle ring, indicating that they'd actually like far more support from teachers, although they recognize they can't be there all the time. You can also see down in the bottom right of their image that they've put other family right in the outer ring, and they want them right in the inner ring. So it's funny how it's such a simple little creative activity can really give you insight into the kinds of emotions and conflicts that they face. You can really see how this young person has family there who could be providing integral support for them. And it's just not happening right now. So we could work with that family potentially as practitioners to try and help them to offer that greater support if they're able. So this next slide, who gives young carers support? This is some data we found out from the survey, and I think it's really interesting and kind of just this one simple graph sort of gives us quite a deep insight into where provision is currently lacking in terms of young carer support. You can see here the top few categories are all health related people, and they're not offering huge amounts of support for young carers. Perhaps that might be concerning. Perhaps they could be offering more, but I find it not quite as concerning as the next category, which is teachers and wellbeing coordinators, which was a sort of catch-all title for support workers in school who focused on their well-being. And you can see here that out of the 101 responses, only 16 of the young people identify teachers as providing strong support for them in their role. You can see really good results here from the young carers project workers. Obviously, this is their primary role, is to support them as young carers, and there's a really healthy 73 out of 101 reporting really strong support from them there. And again, family and friends also emerge as really key relationships for them. And if we move on to the next chart here, this was a slightly different question in who recognises them. So there's that distinction between support, so actually taking actions to positively affect their daily lives and experiences. And then there's simply recognition of the role that they have to perform and the demands that it places on them as people. But we actually see quite similar breakdowns here of who is actually recognising, let alone supporting young carers. Again, the dedicated support workers here come out on top, along with family and friends. And you can see, again, health-related professionals right down at the bottom there, with teachers and counsellors somewhere in the middle. So I just want to bring this home with a qualitative experience that a young carer shared with us. And I include this quite long extract, which they put within the survey responses, simply because it covers so many different relationships that they have. And the way that they experience them in relation to their young caring role. So some of the things I just want to pick out here, pupil support, always too busy. Chemist is nice when I pick up medication. So there's that sort of, they're friendly, they're nice, but are they maybe not asking the questions that they need to ensure the young person is getting the support that they need? Social workers, okay, but just as I trust them, they leave and we have to start again. Obviously, those of you who work within social care will know that social worker turnover, when people have multiple social workers as children, that's always a point of concern, regardless of their particular support needs. Teachers are pants, they just want to shout and not listen. So here we have that tension between the sort of pastoral role of teachers in supporting the well-being of the children in school, but also that authoritative learning-based role where they also just want the kids to get their work done. And that's challenging for young carers who are bringing a lot of heightened emotions and responsibilities to school. And then just briefly, we get family and friends relationships emerging in this extract as well. Some friends are cool, but some take the mick or complain when I cannot come out. We'll come back to that in a minute. Family are only there when it suits them or they want to look good. So this sort of highlights the way that some people can drop in and out of caring roles, but for young carers, if they're living in the same household as the person they care for, it is there every day, it is inescapable, and they cannot drop in and out themselves. So we're moving from the survey data now to some of the data we got during the workshops. And one of the activities we ran during the workshops was on, well, it was focus groups that were on the subject of what advice young carers would give to brand new young carers who were just starting in their roles and needed to know what they needed to be aware of and what to think about. And in this workshop, we got some quite emotive responses from the young carers who sort of reflected back to their own experience of starting caring and thought about the frustrations that they'd experienced. And lack of awareness from their friends at school was particularly tangible as a sore point for young carers. And they really wished that more people could understand. If all you've been doing for the weekend is literally just being there, this young carer talks about how he really has to watch his sister And friends are like, yeah, I have to look after my younger siblings too. It's not a big deal. And he's like, no, you don't get it. I really have to watch her. I'm responsible. She might hurt herself. And it will be my job to prevent that because there's no one else doing it at the time. Another young person talked about bullies at school and how young carers could often be targeted by bullies because they could tell that they were vulnerable. This vulnerability was something that emerged again and again in the focused groups, and the young carers warned others to be aware that this might happen and to be resilient when it does. The Worry Rocks activity was a really lovely one, but it was also one that produced quite upsetting data, I suppose, at times. We gathered a large number of stones, at least one for every participant, and we invited the participants to write on little pieces of paper their biggest concerns and fears about their role as young carers and their general sort of life experience, to wrap them around a rock so that it would be secret, and then put it in a backpack. And the idea of this was to produce this really visceral kind of representation of how much emotional baggage the young carers have to deal with on top of the general emotional baggage of being a young person, of being a teenager, which is quite enough as it is. At the end of the day, we then invited young people to pick up the bag as a sort of, as a way of release, of feeling and releasing some of the emotions that they felt. And the bag got really, really heavy. And it provided a really strong way of talking about how much weight they have to carry. And bullying and social isolation and exclusion from their peer activities all emerged as the key things that young carers worried about and felt affected them from day to day. And we can see in the next slide, I'll show you why this emerges as a particular issue around timelines. So we invited young carers to record their normal daily timeline of what their activities might be. And for most young people, school is going to be the big chunk of that. And then there's going to be some getting ready, some, eating and things like that. And then quite a lot of free time, sports, extracurricular type stuff. Young carers had rather different timelines than you would expect from young people. And I'm just going to show you the timeline while I talk through it. This is my day as a young carer, a 14-year-old. We can see that immediately, as soon as they wake up in the morning, they've got responsibility for siblings to help them get dressed and get up. Then we have their school day, where they also list the other things they have to do immediately before or after school. A lot of cleaning, medication, preparing food, cleaning up after pets. They've had to go into the next box to show that, because we put separate boxes for school days and weekend days, but actually they need to do these things every day. It's not when they have free time, it's when those things need to be done. And you can see as we go on for 4 o'clock, 5 o'clock, we've got cleaning, cooking, eating, sorting out siblings again, medicines, time for a bath. And then just want to highlight at the end there, sleep and internet at night time. So obviously for a 14-year-old, you'd be hoping they'd be getting to sleep by about 10 or 11 o'clock. But young carers have so little free time during the day that what we often saw in the timeline activity was that they were taking time out of nighttime, out of sleeping time, to actually grasp a few hours to themselves, to play video games, to go on the internet, to try and have some of that, the normal activities that young people would be engaging in at these times. I think this really brings home how much of a strain on their emotional and mental health that young carers can be at this young age. As some people have mentioned in the chat, this is a really critical issue here. We really need to be ensuring that mental health provision for young carers is really, really strong. But if we think back to the slides where we were talking about who's supporting young carers, only 10 out of 101 survey respondents reported that their counsellor or therapist was there providing good support. So there's the question of, do you have a counsellor or therapist? Apparently only 10% of our respondents did. Or if it was more, then that counsellor or therapist is not providing the support that they actually need. Another thing I want to focus on in reporting on my study was education, which emerged as one of the key themes in all of the data from the survey and from the workshops, that school and education was a really, really problematic area for young carers. So only 43% said that they were always or often given the right support in school. I'm not going to read through all these quotes, but just by scanning them, you can see the general theme here is that teachers and other well-being support staff are felt not to understand what their role is, not to understand how to support them, and not giving them flexibility when it's really needed. So these are obviously huge concerns, because teachers have the capacity to be a really strong support relationship for young people. And we saw this in other forms within the workshop data. So in the letterbox activity, posting letters to the First Minister, 50% of the letters said that they wanted more support in school. And one suggested that workshops that go to schools to make teachers more aware of the position that they're in and the flexibility that they need. A new activity we haven't talked about yet, the supporting wall activity. We created a load of bricks and provided a large wall for them to sort of build a wall on of who is supporting them in their lives. And we asked them just to name or describe people's roles. So like teacher, friend, aunt, whoever it might be. And these were supposed to be like the strongest supports in their lives. And out of 109 bricks that the young carers contributed, only 7 included school and teachers. And then the eco maps, which I've called here the concentric circles, sorry about that, it's actually the same activity. So 30% of under 13-year-old young carers reported moderate closeness. So remember, that's that middle ring of people who are sometimes providing support. And this compared to only 10% of 13 plus. Now I've pulled this out because of that point that teachers are even more important for younger children. And what we noticed when we were looking at the eco maps is that those with fewer overall relationships listed in their eco maps of people who are supporting them, that correlated with teachers being the more important relationship for them. So it's really important here that, especially for primary and early secondary age children, that teachers are trained on providing the kind of support that they need, because it might well be the case in many instances that they are one of the primary support relationships for young carers. And then we also asked them to qualitatively provide suggestions for what could be done to support them better. And we're going to come back to this later on when Pfizer speaks, but here are some of the key points that they raised. So more support staff visiting the home and helping them engage in some of their caring activities. It was often felt that they didn't have enough trained professionals coming in to help them care. They wanted better recognition in education and in medical settings for the important role they play and the challenges it brings. They want someone to talk to about their problems. So again, there's that real need for mental health and emotional well-being professionals to be in their lives constantly, not just during a crisis situation or when they start manifesting their own mental health or emotional difficulties. Money, of course, came up a fair amount, not universally, or that, it was something that some young people felt very strongly about. Perhaps they were in precarious financial family situations, but money did come up as something that would make their life so much more easy. But not only that, that would make things fun sometimes, and access to recreation and things like holidays was something that a lot of them didn't really have because of money. Social workers taking action, social workers being more active in caring for them and supporting for them was really important. And then better understanding and support at school. So I'm going to hand over to Pfizer now to talk about assessment for young carers, and I'll sort of dip in and out of this as well. So Pfizer.
Hello. So in terms of assessments, I mentioned earlier about the Social Services and Wellbeing Act, and I just wanted to point out one of the key benefits of the Act is that it doesn't specify that a certain number of hours or a certain level of caring needs to be done. if there's a negative impact or if there are support needs for that carer, they should be assessed for that rather than having like a arbitrary minimal threshold. And the other thing to mention is that in local authorities, there's lots of different ways of assessing and identifying young carers. And so it's quite difficult to talk, kind of give an overview of that, because every local authority works in the way that suits them. So I don't know if it might be beneficial. Kat, are you around still on the call? I know you were having problems with Zoom.
Yes, I'm here.
It might be helpful for you to just highlight how it works in your local authority as an example of one way assessments can be experienced by young people. But I've left on the slide kind of a really good link to the Social Care Wales website, where there's a lot more detail about assessments, including a PowerPoint presentation, and that's got all the kind of the nitty-gritty details. So Kat, over to you.
So like Faiza said, every local authority has their own way of doing it. So this is just how we do it in Carmarthenshire. So we've got two kind of branches of young carer support. There's a small team that look after children in a very high level caring role for their parent, so that their main adult figure in their life they're caring for, and they have a very intensive support. And then everyone else, sibling carers, children caring for parents in lower caring roles, all come to my team. And so in terms of assessment, one of the things we've learned, which is really valuable to know, is that quite often you're not going to know what's going on in one conversation, even if it's a 2-hour long, let's sit down and talk it all through. But actually, we find that the children need to suss you out as a person, spend some time with you, decide if you're trustworthy, and then they'll tell you what's actually going on. So we have a system where we are constantly having kind of informal mini reassessments, where we check in with the kids and say, oh, right, how things are going at home at the moment. How is school? Do you have time with your friends? Do you have time for yourself? How do you worry about money? All these different conversations. And we find that within the first 3 months, what a young person has said on the first meeting to what they say 3 months down the line can be very dramatically different. So I think people who don't work specifically in a young carers project but might be in a role that could refer into projects, if at first you have a conversation and they say, oh no, we're not caring, it might be worth revisiting the conversation at a later date when they're more ready to say, actually, this is what is actually going on. But I think the best advice is, if you don't know how it works in your area, is to talk to your local young carers team. I have many people ring up to me and say, I might have a referral, I'm not really sure, can we talk it through? And then through that conversation, we decide whether they would apply for our project or not. So the conversation and having a contact in your local area will be really important for you.
Great, thank you. Back to you, Jen.
Just wanted to briefly raise something about assessment that came out in my research, which is the amount of skills that young carers really felt that they needed, and cooking and basic first aid came out as top, which you'd really want young carers to be skilled at. However, the issue here around assessments is that 74% of young carers in the survey I led reported that, to their knowledge, no one had assessed their care and support needs, which may obviously not be completely accurate. They may have been assessed without realizing, but the very fact that they didn't know strikes me as really concerning. And I think we really need to do something about ensuring that there is a coherent and visible assessment structure being rolled out across Wales, and hopefully the carers ID card will go a long way to supporting that. So I just want to hand over now to Ed, who's going to talk about his PhD research. We are running a little bit behind, so we're going to have to shorten the breakout sessions just by a little bit. So do remember what I said about being concise when we get there. So I'll hand over to Ed and then we'll have our breakout sessions, okay?
Okay, so moving on to the Caring Lives project and the findings from it. I will, where possible, I'll try and be like fairly brief with these results. So just to very briefly pick up on the method that I use. So this study was about depth rather than breadth. So I worked with a small group of 10 young carers in a lot of detail. 5 of who were recruited through schools with confidentiality procedures in place to prevent identification, and 5 of who were recruited through young carers projects. So I use what we call a longitudinal phenomenology. I'm not going to explain it in too much detail. The definitions are up there for the 2 words. But in short, I worked with each of them. I met with each of them individually 3 times over a year-long period. And then phenomenology is basically about understanding perspective. So I was interested not only in the caring that they did and the effects and the impacts of this caring, but also their perspective, so how they view their caring, if they view it positively or negatively. Put them together, and I was basically considering the change that you have happening in the lives of the young carer and in the lives of their family over time, and then looking at the impact on mental health. It gives quite a positive, it gives a real potential to look at a particular cause and a very particular impact. So there's 3 intervention strategies that I want to highlight. The first of which is health support and information. So this is very much reinforcing previous research that's been done, but using maybe like a different method, if you like. So the role of health services in supporting young carers, particularly those with more medical roles. So I'm going to be focusing on 1 young person mainly, or 2 young people for each of these. This one is about Sophie, which is not her real name, who cares for her mum who has diabetes and also a hearing impairment. So just to explain the picture that I've put up here, every young person that was involved in this project were given a large sheet of paper which had a body, 2 bodies on it, one for the young person and one for the person that they cared for. They were able to draw, scribble, doodle, use it however they wanted. And with Sophie, it was really useful because she drew a lot about diabetes and about her caring. And as someone who has no kind of medical background, this was quite useful to help me understand what was going on. So this quote here has some context in it, and I'm just going to kind of summarize it. So Sophie manages her mum's hypers and hypos. So basically when her blood sugar moved outside of the normal range. In particular, she had a condition that caused her sugars to fluctuate a lot at night. So every night, Sophie was staying up till past midnight, keeping an eye on her mum. And then if she had any worries, she'd potentially be staying up till 3 or 4 in the morning. And this was causing tiredness that then impacted on her mood. So if we can move on to the next slide. When we met for the first time, Sophie said her mum was expecting to get a diabetic pump with the idea that it would hopefully reduce her caring, and in particular reduce her nighttime caring. There was also the potential that she would be trained in using it. So straight away, there was a real, you could really look at the interview and say there's a real, something I can really focus on, possible cause, and I can look at how it affects her life over the next year. So when we met for the second time, so we've got this first quote here, when we met for the second time, she talked about initial problems with the pump that were due to things like faulty equipment and needles in particular not working, and basically like concerns that the intended benefits were not going to happen. By the time we met again for the last time, there had been quite a big and very positive difference. So the pump was working properly. Sophie was finding it complicated to use, but was getting more and more confident. And then in terms of things like her caring, it was reducing time overall and having a real impact in terms of nighttime caring. So she was getting more sleep, She was going to bed around 9 or 10 in the evening, some nights sleeping all the way through. And then you've got less tiredness, causing less stress and better mood. So just to very briefly compare it to some of the others, Sophie was the only participant who was getting support from health professionals. Quite a lot were attending appointments, medical appointments, so there was a real chance to identify which seemed to be being missed. And they really wanted to be more involved in appointments, but were feeling largely ignored. Many instead were being informed by family members in terms of how to care for particular things, or teaching themselves. So very briefly, there was one other young person in particular called Fia. She was caring for her mom who had bipolar disorder, had been sectioned, and when released, Fia was taken on lots of monitoring and companionship with little kind of advice. Her mum made lots of progress, but last year was sectioned a second time, and had regressed slightly when released. And Fia, like several years later, with a better idea of her mum's support needs, was able to look back on 2015 and feel that a lot of the caring that she had been producing, a lot of time that she's been spending, probably wasn't really necessary. So that kind of highlights maybe the role of health services. Moving on to the second one. So this is on improving relationships and the relationships between the young carer and the person they care for. I wanted to include two examples because for the vast majority of young people, they had a very positive relationship. And I think when you look at past research, I didn't really find evidence of this idea of parentification, where the child becomes the parent and you get almost like a full role reversal. Instead, there were some aspects of parenting that were limited, but they very much made up for it in other areas. So with that in mind, I've got an example here of Martin. He cares for his mum who has anemia caused by a blood disorder. He's a relatively recent young carer, having been doing it for about a year, and cares for about 3 hours a day. So this quote is from the second interview, and in the first and second interviews, he talked about adjusting from this idea of a normal childhood to quite high caring responsibilities, and the kind of frustration that developed from having a large number of small tasks to do every day and potentially lots of tasks at the same time. He found that he had less personal time and that it was placing a strain on a relationship that was normally extremely strong. When we met for the third time, they basically had an argument, but it had helped to kind of resolve the situation a lot. So he was taking problems to her, they were chatting through, she was listening to it, and it was making a real difference. So you can see there's no real need for an intervention because things, in this case, got sorted out, like almost like naturally. But this wasn't the case for all of them. And in particular, one young person called Patrick. So Patrick was caring for his sister, Sarah. Sorry, if we can move on to the next slide. Patrick was caring for his sister, Sarah, who had cerebral palsy, learning difficulties, and also poor eyesight. He was carrying out extensive caring. So he was caring in the morning, getting Sarah ready for college. He was caring in the afternoon after school, and he was also monitoring her at night. He'd quite often be staying up 1 or 2 hours after she went to bed, often without his parents knowing, just to keep an eye on her. Just to very quickly explain this picture, I used some quite simple activities that then would become the basis of discussion. And with this, Patrick was given pairs of impacts from previous research. They'd be opposing. So for example, being angry or being calm, and would also be able to write his own and add his own. And we looked at whether impacts was due to the responsibilities that were being taken on, the support that was or was not being offered, and also the identity, so how he viewed his caring as positive or negative, or somewhere in between. And I've lost where I am. So what you can see here is that for Patrick, it was quite a complex situation. So he was finding quite a lot of negative impact in terms of anger, sadness, also feeling different to everybody else, not just people that didn't care, but to all other young people, which made him very private. He attributed these to his caring, but also to feeling trapped in terms of his role. He didn't really attribute it to his sister, but they had a very difficult relationship. She had mood swings and anger, which he attributed to her disability rather than her, and he felt underappreciated for what he did. What we found after the third meeting, which was to say happened this summer during the COVID pandemic, there had been quite a lot of positive benefits, having a parent around more, spending, which meant less time caring. He had more personal time, was feeling less tired. But in terms of his relationship, it deteriorated further. So Sarah had been shielding early, was getting bored and lonely from not seeing her friends. And then when Patrick went into lockdown as well, he increasingly felt that she was intentionally annoying him. And the negative impacts, in particular anger that he had previously been feeling towards his situation, were increasingly being directed at his sister. And for me, this highlights that you've potentially got a quite small proportion of young carers who have this kind of challenge, and there's not really a lot of provision for it. So very quickly, moving on to the third one. So this is on the need for active support. I think we need to skip on again, sorry.
Yeah, sorry.
That's okay, it's fine. Very briefly, thinking about active support. This was a general theme that came up. Young people feel valued when they're actively supported. So for example, by a young carers project that provides services rather than by a school register that quite often stays in a drawer and doesn't get used. It was particularly true of schools. And 5 were not known to schools at all. The 5 who were known, they didn't want schools to be overly involved. They preferred to get help if they needed it, and preferred to develop a relationship with a particular teacher. I just want to focus very quickly on 2 young people though. So you've got Harry and Fia, who went to the same school. As you can see from the first quote, Harry felt there was no evidence of active support for young carers. Fia went slightly further. She thought that there was processes in place, a register, a member of staff with specific responsibility, and this idea of regular meetings, but they weren't happening. Like others, Fia was very wary of school involvement, but Harry was different. Harry was different to everybody else. For him, he felt young carers need support in schools on an individual level, and the only way that that can happen is for schools to know more. So he felt that schools should know about what caring young carers do and what their needs are. This presents an interesting challenge because if we know that most young carers don't want to be identified, or they don't want schools to be actively involved, and we know that schools have limited capacity as well, how do we get from where we are now to a position where there's greater individual support in schools? That is pretty much it. I just had a final thought that we've had 3 interventions. 1, health services, which would be particularly for medical carers. 1 on this relationship, like problematic relationships, which is another minority again. And then the 3rd on individual role of schools in offering support. And it just, for me, it raises a question, an open question, so I'm not going to answer it. is there a need for support on an individual level alongside the support that we know is offered by project and that is very, very much valued? And if there is, how do we do it?
Thank you so much. Going to now move over to our breakout sessions. So our exchange coordinator, Sian, is going to divide everyone into groups. So Sian, if you want to begin that process. Sorry to anyone who was cut off mid-flow as they were in my group because of time, but we are reaching 11:30. So I will quickly hand over to Faiza. I don't think we've got time to do summaries of the workshops, but perhaps that's something we could send out to you all in a follow-up email along with our links and reports and things. So Faiza, if you'd just like to finish us off, then I'll pop back to our shared slides.
Hi, everyone. It was so interesting just having really brief conversations with you. And like, I think this event's really highlighted how much knowledge and desire is out there to make things better for young carers. So, you know, after this session, the conversation doesn't have to end. You've got the details for exchange, and I'm sure she can link you up with each of us if you need, and I'll add my email address as well into the chat. But I know we've only got a couple of minutes left. So the first thing is we've got some new education resources on our website, carers.org/Wales/education. They're incredible. And I know a lot of you are having difficulties with schools, so please check those out. Consider putting Young Carers Action Day in your diary. For March 2020, there'll be lots of activities going on. And the last thing I want to say is,
Sorry, is it in 2021?
Yes, it's supposed to be 2021.
Oh, okay, there we go.
Yeah. And then I suppose lots of us have spoken about the consultation. You know, your voice matters. The consultation is for everyone. So just do report back to that. You've got until the 20th of January. And the last thing is, I think we've talked a lot about policy and the big picture, but I thought I would finish the event by sharing a video which we recorded especially for this event, asking young carers what matters to them. So I'll just play the video and just say thanks to everyone.
I had a bad conversation with my doctor from my dad when my dad was in hospital. There was a possibility that he had no brain stem function, which means he was practically brain dead. And he told my mum, and he didn't wait for me to be there. And my mum had to tell me, and the way she told me made me feel even worse because she was obviously emotional. So I would have preferred a doctor, but he didn't wait for me, which made me feel less insignificant than what I was.
I was speaking to one of my teachers in college who didn't understand the reason why I wasn't comfortable doing the work in the classroom, because it was the first week of college and I was made to watch a video that was very close to home, and she didn't quite understand the reason why I didn't want to take part. So she was very negative.
The whole situation of me having to leave early or having to go to hospital appointments with family members. The schools really didn't understand why a child would have to go to appointments with a parent, when in reality I'm the only person that can go and actually process what they're saying. They were like, just go and do stuff in your own time, not in school time. It's like, I can't force them to give me an appointment on the weekend. It made me feel quite low, to be honest.
My brother has a type of epilepsy, and one of the boys in my year, during one of our skills days, they thought it was funny to fake a seizure right in front of me and say, oh look, it's Sophie's little brother. To have something so personal to you be degraded like that, to make it seem so horrible. And I finally felt comforted. I was finally being open with people. I had a support system that felt comfortable for me, and for someone to do something in literally less than 5 seconds, it just brings down everything.
My dad, he's not very well, and whenever he has a good day, my family members, the ones that don't understand, will assume that he's magically grown better from his illness. They think he's taken a magic pill to cure him from his illness, and that irritates me half the time.
They listened a lot. They didn't tell me that I needed support, or they didn't tell me things that I needed to go somewhere. They just listened, and they asked questions about my life, and they asked questions about what I do to make me understand that I was a carer. It made me realise who I was, and they listened a lot. That's the best thing.
I think they should approach us with a more sensitive approach rather than a full-on, you're just a child, you should just, be a child. It's like, it's not possible for us. So maybe be more sensitive and listen to what we have to say, because at the end of the day, we're more mature than most people our age.
If you're acting mature, they've got to treat you mature, not like a child, and show you the respect that you're showing them when you're trying to have a decent conversation with them about this situation.
Just be willing to listen, to try and understand. Just try to just be positive with it. Just try to, be a friend, and not be too quick to judge.
They should be sensitive. They should be very sympathetic, but not too sympathetic. You shouldn't be like, oh, I'm so sorry for you, it'll all get better. You should understand the situation so that you don't slip up with, oh, so do you have to do this? Stereotyping is also a strong problem. Like, all young carers don't have any time whatsoever. We do have some time, but sometimes that time needs to go for ourselves. Don't treat us like a child when it comes to doctor's appointments, but then don't expect us to be the mature ones when we're with our friends, when we're trying to have fun. At the end of the day, we are still children, so we want to be children with our friends, but also we are pretty mature for our age, so we do understand what's going on with our family and we want to help.